So this ARANET is actually bringing together 14 agencies from 11 different countries. In this initiative, we try to foster collaborative work between clinics, research groups, and companies.
Infectious diseases still are one of the major diseases of mankind, more prevalent in developed countries than in developed countries, such as in Europe or the United States.
And they can affect each and every one of us. Not only the very sick, not only the immunocompromised. It can affect children and adults, it can affect healthy people and sick people. So it should be the interest of each and every person in the community.
They are responsible for about 25 to 30% of all death cases. This is dramatic, not only from an individual point of view, but it also generates a huge burden on the health system, for example, causing direct costs for diagnosis and for therapy, but also indirect costs if you think that people who are sick cannot work.
The problem of infection is evolving and increasing. There are new infections that are almost being invented, so to speak.
We thought at the end of the last century that we would be able to control infectious disease thanks to vaccines, thanks to antibiotics. What we have learned was a hard lesson. Pathogens are able to change themselves so that they can resist against all the drugs that we have produced and developed.
And this, of course, requires enormous research efforts to combat these kind of diseases and to combat these microorganisms.
We had to deal with new pathogens which come up because of the climate change. They come up because of the travel between countries.
Bacterial infections are cause of very high mortality and morbidity and requires very quick medication and also application of vaccines.
And actually, as we speak, around the world, people are dying of infections because we do not have the antibiotics to treat them with. So this is an imminent threat that is increasing and expanding, and if we will not do something about it, we will go back 70 years ago, before we had antibiotics, where people just died from very simple infections.
Our market of antibiotics is very narrow now. We have no new drugs, so we have to take special actions to stop emerging new resistances.
If I think of other important diseases like cancer, like cardiovascular disease, like neurodegenerative disease, we can predict maybe 50 years from now how important those diseases are going to be, just based on the average age of the population and whether they smoke, whether they drink. We have a fairly good idea about how many people will be affected, and government can plan to fight this disease. When it comes to infectious disease, everything can change over a weekend, and then we have to react extremely fast.
Rapid diagnostics is also one of the key issues of research. Continuous efforts are important to develop new drugs.
The future research should focus on the pathogenesis of infectious diseases, how they spread, why they attack certain population, what are the reasons for spread and dissemination, and we should look more broadly into pathogens and microbes.
Like with any other discipline, if we just look at it from a narrow spectrum, i.e. what would do the doctor in the clinic, or what would do the pharma company when it tries to design a new drug, we're not going to succeed. We have to join forces. We have to work interdisciplinary. We have to have convergence. Because when you think as a think tank, you have group thinking, you have expertise in different areas, you can join all these forces, and you can come up with novel solutions. Up till now, when we just looked at things in the traditional way, we didn't have too much of success.
The best way to combat these new agents is to form a multidisciplinary consortium, networks, and agencies like ERANET, can be extremely useful in this area.
Government and public funding is essential in being able to do both basic research as well as applied research.
In terms of collaboration between research labs and companies, it is extremely relevant for both sides.
But if the public sector, if governments, if patients, if physicians, if academia will join forces and come up with new solutions, then we will have more chances of developing novel technologies to fight infections.